Hey everybody, my name is Manik Madan, and in this video, we're going to be talking about how to become a doctor in the UK. In this video, we'll be interviewing Dr. Muskan, who is an intern in Manipal, and she'll be taking us through PLAB, which or UKMLA. So it's going to change to UKMLA soon too. So she'll be taking us throughout like the whole process as she is approaching it right now, and she knows everything about the new stuff that's happening in PLAB because even that's changing. So, hey Muskan, can you give us like an intro about
Hi.
yourself? Hey,
Firstly, thank you for having me here.
yeah,
And to everyone who's watching this, hi, I'm Dr. Muskan. I'm currently an intern, like Manik said, in KMC Mangalore. And right now I'm posted in surgery and it's quite hectic, but yeah, just working through it.
before we jump into everything, I just want to ask you like why like pursue medicine in the UK? Because we have NEET PG, we have USMLE.
Hmm.
Like, why are you going specifically after UK, and like what's the benefits of doing medicine there?
Hmm. So one of the major benefit I feel over pursuing medicine in UK over US or India is the work-life balance. The approximate amount of time we have to spend in the hospital is 48 hours per week, which is like comparatively very less. If you see in Indian residencies, the residents are in the hospital like at a go for like 36, 48 hours. And that's extremely exhausting for them. And I've seen them like working 24 hours a day, and then that shift just like keeps on extending to the next day and to the day after that. And I realized that I don't want to live like that. Like I did pursue medicine, but I don't want to just get into this field and not have any other life except for just being a doctor. So that I feel is one of the important thing and an important advantage over US and India. Secondly, I feel in UK, like if you enter the system, you come out as a super specialty, like you do the super specialty and you come out as a specialist, which is
Yeah,
not there in US or India. So in India, especially, like if you do NEET PG and if you don't get it in the first go, you'll have to take a drop, maybe one drop, two drops. Then you'll get NEET PG, do that for 3 years. Then again, for super specialty, if you get it in the first go, good enough. If not, then again, take a drop. And that just like extend the process. So like 3 years and then 3 years super specialty, six is already there. Then if you add up the drop years, probably 8 or 10. That just adds up to the same thing as UK. It's just the amount of commitment you have to give to UK is like different because people just get scared. The moment people get to know that, oh, UK is for 8 years and they're like, oh my God, I won't be a doctor per se. Like I won't be a specialist till 8 years. And that part really scares them. But if you compare to India or US, it's almost the same time. And there are less number of exams. They're just like after you get into lab and you get into your residency, you have like one exam, your MRCP or MRCS, that has
yeah.
like, again, steps of its own. But except for that, I feel it's not like, you don't have that extra pressure that you have to crack the super specialty exam or you have to crack the NEET PG. So I feel the pressure is also less in UK compared to US or India. Lab is pass and fail, and the same stands for MRCP. So that's like again a good thing. You have less pressure on your mind, whereas compared to NEET PG, it's like a rat race. If you saw, I think yesterday or day before yesterday, the ranks came out of NEET PG, and everyone's like either it's like again spectrum either way. So one side of the spectrum, people are happy they got the scores they wanted. Other side of the spectrum, like they're sad and they might take a drop or they might take up residency in a deemed college or a private college, which costs around 27 lakhs per annum, and that's a lot compared to UK, which is like your PLAB will almost cost around 5 lakhs to 10 lakhs.
That's it.
So
Yeah.
yeah. So if you compare that, like 10 lakhs compared to 25 lakhs per annum, and that 27 lakhs, you'll be giving it for like 3 years. So money wise, also, it's a major advantage.
Yeah, and how much do people earn in residency in the UK? Like when you become a resident there, like how much do you make per year, per annum?
If you like compare it to India, your starting salary would, I would say, be per month, it's around 3 to 4 lakhs And that's like the starting, that's like ST1. So as you like climb up the ladder, that's going to increase. And that's just for the 48 hours per week. So that doesn't include any night shift, that doesn't include any locum, that doesn't include anything extra that you do. So 48 hours a week, which you work for, you're going to like get around, 3 to 4 lakhs a month. If you want to earn more, you can, if you want to earn more, you can like do locums, you can do night shift, you can work in a private setup. That's just up to you if you want to earn more.
So that's like 36 to 48 lakhs per year.
Yeah.
And do you think that's enough considering like UK is so expensive itself?
Yeah, like I have a couple of friends who are in UK who are doing residencies over there, and some are doing non-training jobs over there. And whatever I've heard from them, it's actually more than enough. You get 1 to 1.5 lakhs per month to save. And I feel that's more than enough. And that too, like at a starting level, not at like some ST2, ST3 level. That's like some starting non-training job. If you get to save 1 lakh also per month, I feel that's enough. That's enough to survive.
And of course, like UK, since it's a developed country, the quality of life, of course, would be way better.
It's very nice, yeah.
The quality
of life is much better, yeah.
And by the way, isn't like once you do PLAB and like MRCP, can you also practice in other countries? And can you go back to India? Like, does that work?
Yeah. So one of the advantages for Indians to be doing their residency in UK is that after they're done, they can come back to India. So it's not the same with like Germany or like Australia or something. But with UK, it's more friendly. And if they want to come back to India, if they like miss their family, if they're homesick, and they realize that UK is not the place they want to stay and settle in, they can always come back to India.
Can you also go to, like, I've heard people going from UK to practice in the Middle East or like Dubai or Singapore? Like, because I feel MRCP is accepted like there. Can you do that now or no? Like,
yeah, so you can do
that. That is possible. Even Australia?
That's possible. Australia, I'm not very sure about, even though like you can come to UK after giving the Australian exam, but I'm not sure about going from UK to Australia.
Now let's jump into the anatomy of the UK medical exams. Like, okay, so what is the sequence? Like, what exam do you give first? To what exam do you give in the end?
Okay, first, you should have a primary medical qualification. That is your MBBS degree. Okay. And you can give your IELTS or OET, that's the English exam. That's the first step to even book your PLAB 1 dates. So after you give your IELTS or OET, you give your PLAB 1 exam, which is one multiple choice exam consisting of 180 questions. After that, you get your results. If you pass, you can apply for visa. You can go to UK and give your PLAB 2 exam. After PLAB 2 exam, you have to wait for the results, obviously. And then if you pass, you can get the EPIC verification. And after that, you can apply to the GMC. So you get your GMC registration done. And after that, you can work as a non-training personnel in UK. So there are like different fields. So like I want to personally pursue pediatrics. So for pediatrics, I need to work 1 year as a non-training specialist in UK. So I know for a fact that after my GMC registration, I will have to like set up my CV and everything on the NHS job site, get a job and work as a non-training personnel for 1 year, and then give another exam, which will filter out like the number of people going ahead for the interview. And then again, the interview process is there, and then you're selected for your residency.
So is this your foundational year that you're talking about, like 1 year working? And then like, is that the foundational year? Like, what is that? Like you told me like work like 1 year as a non-trainee.
Yeah, that's a foundational year. Yeah, some of the specialties require that, like pediatrics, OBGYN, and your dermat, ENT, short subject. Whereas medicine, surgery, and psychiatry does not require that. You can directly apply for interviews. But again, in UK, they prefer that you work for some time and then you apply for interview. It's going to be easier for you to be accepted there. Right. Because you'll know the system.
It's different because I've heard like even to pass MRCP and all these exams, like which you can give even without giving PLAB. It's very hard to pass
Yeah.
MRCP2 because it's just like very different how it's practiced, isn't it?
Yeah, because see, every country has its own way of practicing medicine. So like for India, everything would be different. The way you approach a patient is different, and that's the same for US, I feel. So I think UK is not any different. They have their own set of ways to deal with the patient and to approach a patient. And again, that's, I feel, fair enough.
All
So
right.
they also want us to, set
Okay.
into that system, and they want us to be a part of their system. So they want us to work and, get to know the system a little better.
Okay. So once you get chosen for an interview, what happens then?
So after you get selected in the interview, you have a core training that varies from 2 to 3 years. After
Right.
that, you have to give MRCP, and then your specialty training starts. That is mostly 4 to 5 years. Again, depending on the branch you want to choose.
How many years does this training last?
The specialty training, again, like I said, it's 4 to 5 years. So your total thing will come out to be 7 to 8 years. Your core training 2 years, and then 4 to 5 years your specialty
All right.
training. That could be like in pediatric specialty, could be neonatology or something in PICU, something in hemat-onco. So it differs.
So in a way, specialty training is like super specialty training
Yeah, super
in India.
specialty. Yeah.
Oh,
Yeah.
that makes sense. And is it
Yeah.
necessary to do that? I'm just asking, like, can't you just do core training and practice?
No.
Like, is it necessary?
Yeah, you have. So you're going to get your full registration, and you'll be called like a doctor, resident consultant over there after you finish your 8 years. You cannot be like, I'm done with my core training. I want to stop here. I don't want to do a super specialty. Like it's there in India. Like you can stop as just a specialist, but it's not there in UK. You have to finish this whole process of 7 to 8 years and then start practicing on your own.
So does your salary also like increase as you become a senior?
Yeah. Every year you climb up the ladder, ST1 to ST7, ST8. Every year your salary increases. And again, if you want to earn more, or if you think that that's not enough, you can always do night shifts, you can always do extra shifts, you can always do locums.
So now let's talk about the English proficiency exams that we have for the UK, which is IELTS and OET. Like which one would you say like people should prepare for? Which one's easier? And like, which one did you give?
See, I personally always suggest people to take OET over IELTS, because OET you have to get B in all the 4 sections, that is speaking, writing, listening, reading, and above 7 in IELTS. The problem with IELTS is that writing, they're not going to give you above 6.5. Like you have to be like exceptionally good to get that 7. So I have known probably 4 to 5 people who've given IELTS thrice and they couldn't clear. And then they switched to OET because they weren't able to clear IELTS in like 3 goes. So yeah, people do prefer IELTS over OET because, it's cheaper. It's around 7,000 rupees and OET is around 33,000 rupees. But overall, if you have to give that exam probably twice or thrice, might as well give OET in one go and just clear it. So I would personally prefer OET. And OET is more like, it's related to your healthcare profession. So if you have writing, it's going to be a reference letter to a doctor or a discharge summary, something like that, which you already like done in your internship. So that's not going to be something like really new, or it won't like require you to have like an exceptional vocabulary or something. It requires you to have a basic English. That's all they need. That's all they're testing for. They're not even testing your medical knowledge. So in speaking, they have flashcards and all. So you have to have this whole conversation, like a patient-doctor conversation you're having. And like the first thing they tell you is, don't think that you're saying something wrong, like medically. Like just keep having the conversation, because just don't stop in the middle. They're not judging your medical knowledge. They're judging your English. They're judging how you talk. So I would personally prefer OET over IELTS any day.
Yeah. And how much time did you take and what resources did you use to prepare for this?
See, OET, I took around 2 weeks. that's also because I had a hectic posting that time. I had orthopedics going on that time, which required me to stay in the hospital for like 12 hours. OET doesn't require you to like have that intense training before giving the exam. You can practice some practice papers, and you have sample papers on the OET website, on their official website. They have around 3 sample papers each section. So if you do them, you'll get an idea how to go about it. And also there are different Facebook and WhatsApp groups of OET, which has more material. So if you like join those, you'll get like more PDFs of like sample papers, more reading comprehensions, more listening comprehensions. So if you want to like practice more, you can always do those.
So I personally prepared for OET myself because now the USMLE process requires that. So like what I would add to that is like E2 OET, which has like a free course, and you can just go through that free course to get an overview of the whole exam, and then go to the sample papers and just solve them. Like that's what I did, and like it took me like 5 days, but I was free, relatively free, so it took me 5 days. I could just go through it, and like, you know, everybody gets an OET gold, by the way, in the end. I don't know. Yeah, I got it. Yeah. So, okay, after you're done with OET, so there's PLAB 1. So how much time should one take to prepare for PLAB 1? And what resources should they use? And like, okay, what centers are there in India to give PLAB 1? And like what dates in the year like you can give PLAB 1?
PLAB 1, like I said, it's an MCQ exam, which you have to mark one of the best options. It's going to be a clinical question. There's no negative marking. So that's like the best part about it. You can be sure to like mark each and every question, because even if you're guessing it, there's a chance that you might be right. You don't have to worry about negative marking. So that. For resources, I would say there are question banks. It's not like, you know, how it's there for USMLE and India, NEET PG, how Indians have like, you know, this Marrow, Preplado, like you have to like stick to those and do those completely. And for USMLE, there's boards and beyonds and USMLE RX. PLAB is a different ballgame. You have to just do, there are some question banks. So people have suggested me to like do PLABable and pass medicine. So if you're done with PLABable, you know, 3 or 4 times, you should for like higher questions, you should start doing past medicine. And you should keep revising these questions again and again, because these are repeated. Maybe not the exact question, but like somewhat similar question would be repeated. Yeah,
the same
it's going to be repeated. Right. For books, you always have an Oxford Handbook of Clinical Medicine and Clinical Specialty. I think that's enough. I mean, that's what my seniors have recommended me, who have passed with actually flying colors.
Okay, so PLABable pass medicine, and how much time should one take to prepare for PLAB 1?
So if you're working and you have a hectic schedule, probably around 6 months should be enough. If you're free, if you're just sitting at home, probably 1.5 to 2 months should be enough.
What dates during the whole year can you give PLAB 1, and where are the centers for PLAB?
It's there. It's not like it's, you know, it's in some only metropolitan cities or something. It's everywhere. Dates, it was 4 times a year, but because of COVID, now everything is a question mark. So at least for 2022, the new dates are going to be out in October end. So for 2022, I think till March, April, they're releasing the dates by October end.
Okay, by October
and then
end.
They're going to release the dates. Till 2021, December, all the slots are booked. So that's like one bad thing about PLAB. PLAB 1 especially, like if you try to book it, the seats are going to be gone in like probably 10 minutes. So you have to be like really fast, and like you should just be on your computer, be ready with your credit card, debit card, anything, and just like book it ASAP.
Sale and out of stock. Yep. And no, so let's say PLAB 1, how do you book it? Like what's the website? And because I have no clue, like what's the website, and when, like where are the dates announced? Like which website?
You need to make an account on your GMC website. So after that, once you've given your IELTS and OET, you fill in your result, and then only you'll be able to see the PLAB 1 dates. So you won't be able to see the PLAB 1 dates unless you have passed your OET or IELTS. So for me also, like before I gave my OET. I was trying to find out the dates and I couldn't find it out. You'll only get to know once like you have entered on your this thing account, your marks and everything. And then on the next step, you will find the PLAB 1 dates. Everything
Got
is on the GMC website only. Their one portal, everything is like that. You don't have to like see multiple websites and just go through everything.
Okay, let's say if I give PLAB and I fail, like what happens? Is it like bad? Does that count as an attempt, which they can see? Like just for USMLE, if you fail it, like let's say step 1 once, so they can see that, and that's like bad for you, right? They can see that attempt. What's it like with PLAB? Like what's the passing percentage? Can they see like if you failed or not? Like what's all that about?
See, even if you fail, it does not matter in PLAB. There are people who have given maybe multiple attempts for English exam only and multiple attempts in PLAB 1 and PLAB 2. Like, I don't know if you know this, PLAB 2 has like a higher rate of failing because it's OSCE. So there are a lot of people who fail by maybe 1 or 2 marks in OSCE. But they like, again, book it and then they pass. And that really does not matter in their CV or in their interview. It does not matter how many attempts it takes for you to like reach there. All that matters is you're there and you have passed.
You know, that's what I love about PLAB is that it's not just like like failure doesn't matter to them.
Yeah.
It's just that you're trying, and that's like the best thing, like you'll get there. That's all that matters. So that's a really good thing I love about PLAB.
And it's less mental pressure also. You don't have to like worry about what if I fail, they're going to see that I failed and it's going to, decrease my chance of getting into my dream residency. It's not that for PLAB.
What about the visa? So let's say like you want to give PLAB 2, which you said like you can only give in UK, right? How do you get that visa for giving PLAB 2?
See, a visa, you will have to apply for a standard visitor visa that lasts for 6 months. So again, it has 2 processes. One is the online submitting your documents and everything, and the reason why you want to visit UK. And second thing is the biometric, which happens. A lot of people end up not getting the visa because the reason they specify is joining or attending the PLAB 2 academy. So people should avoid that. People should actually give a reason for going to give PLAB 2 because that is verified. That's like a proper exam that you're going to go and give. But going to attend an academy is not, it's not that great. It's not like verified by them that, you're going to go into some academy and learn something.
What about PLAB 2? So like, where can you give it in the UK? Okay. And just like a brief overview of PLAB 2, like what is this all about?
See, PLAB 2 is, like I said, OSCE exam. It judges your practical skills, your interpersonal communication skills with the patient. And you can give it in Manchester, UK.
How long of an exam is it?
There are 18 stations. There are 18 stations OSCE. So again, there are like separate rooms. So you have to like go and person would be there who's going to be judging you. They're going to judge you on 3 bases. One is communication. One is your skills. One is your data gathering.
Okay, for PLAB 2, like how do you prepare?
Like I mentioned, the academy thing during the visa. So a lot of people join some or the other academy because, if you're going to give PLAB from India or some other place, the place where you work is going to be different. Your work ethics is going to be different. The way you work is different, and the way you approach a patient is different. So people prefer to take an academy course for like 15 days and then practice over there for some time and then give PLAB 2. I mean, that's what a lot of people do. It's not a compulsion. There are people who have given PLAB 2 directly without taking an academy course and they have passed. But to be on a safer side, because again, it's a very expensive exam, people prefer to like take an academy course. Because see, you have to know specific like skills. You need to portray skills over there, like again, OSCE. So you should like be thorough with your consultation skills, your diagnosis and language, examination, findings. And again, like a rapport with your patient is like extremely important, like how you communicate, how you have a rapport with the patient. and how much you're listening to the patient, because that's also very important. Like you can't be the one always talking, and the patient cannot always the one listening. He or she also has to talk and like tell you what problems he or she has. So all these skills are like extremely important. So these are the ones which they'll be judging over there.
Does your medical knowledge matter in PLAB 2?
Yeah.
It does.
Yeah.
Because I was seeing this another interview where like somebody said that like your medical knowledge does not matter. Like PLAB 2 is all about your ability to establish a rapport with patients. And like they don't really care about like if you came to the wrong diagnosis, like if you come to the wrong.
See, you can come to a wrong diagnosis, but your approach should be right. Yeah, in India also, there are so many times your approach is right, but your diagnosis is wrong. You're not penalized for it, but your approach should be right. I remember when I was seeing some Marrow video, and Dr. Rakesh was telling something about his PLAB 2 exam or MRCP exam.
MRCP.
I'm not sure.
I know MRCP.
And he was telling something about MR, how he, in just like 2 seconds, he diagnosed the patient as MR, even though it wasn't MR, it was something else. He failed because of that question.
Yeah.
So that's why, like, your approach should be right. Your the way you think, the way you come to a diagnosis should be right, even though your diagnosis is wrong. Because see, we are not consultants. We haven't worked for like 10 or 15 years listening to murmurs, listening to everything. We can be wrong, but I feel the way you approach a disease and the way you diagnose, examine, that is important. The approach is important.
Yeah, process more than the outcome.
Yeah.
All right. And okay, for PLAB 2, like which academy would you recommend people to join, like that you know of?
See, I've spoken to a lot of seniors, and everyone has told me that you can join any academy. It is not like one or like the other academy is the best. Like if you join any academy, it's sufficient. It's not like there's only one academy which is the best, like some medical college like AIIMS. You can join any academy.
What's the total cost till like PLAB 2? Like, because I feel after this, you can somehow start earning, right?
See, after PLAB 2, you have to do your GMC registration and all. After you're GMC verified, then you can start earning as a non-trainee. But before that, you are not earning. So like I said, IELTS is cheaper than OET. So IELTS would cost you around 17,000 rupees and OET would be 33,000. Your PLAB 1 is around 24,000. Your PLAB 2 around 88,000.
Okay.
And then if you choose to do a PLAB 2 academy, that is around 60 to 70,000.
What's like the total cost now?
With the OET, with the flights, with the work visa, and with like daily expense when you go there for your PLAB 2 and all, it reaches around 5 to 7 lakhs.
That's pretty reasonable, actually, right?
And it's pretty reasonable.
So after you do this, you apply for GMC registration. How do you apply for that? Any ideas? Like, how do you do that?
Again, on the website only, you apply for the GMC registration. You again fill in your whatever PLAB 2 results and your EPIC verification, you get it done. And then you apply for your GMC registration with all the documents, like your primary medical qualification, like your college, graduation, certificates, and your passport and all your results together.
Once that's done, what work visa do you apply for? What's the name of the work visa? How much does that cost after GMC registration? There would be a work visa, right?
Work visa costs around I think 24 to 25,000. And this is included in that 5 to 7 lakhs I said.
Once you start like that, okay, you're done with GMC registration. How do you get your job? Like the one that you like, what do you enter? Because of our like foundation training and all. So like what happens after you get?
So there is one NHS job portal. So you have to set up your profile over there, and you should start making a CV. So when you're applying for a job, there will be a lot of jobs which require you to upload a CV, but there are some jobs which do not require you to upload a CV. From what I have heard, you should always upload a CV regardless of them asking, because CV, like, it puts you, like an edge over the other person. They know what you've done. They know what you're capable of. So that would be a better thing. And in CV also, there are like multiple things, like, any training courses that you've done, that's like extra compared to a regular person. Or, any research you have published in some international journal, any audit you've done, or any teaching experience you have, or any leadership qualities you have portrayed, or any volunteer work, any job experience you've had before. So all that matters. Why would they take a regular person who hasn't done any research, who hasn't done any audits, who hasn't had any teaching experience or any leadership qualities over someone who's had all of them? Because in PLAB, marks doesn't matter, no. It all comes down to your CV. So your CV should be like rock solid.
So CV does matter in the like I did not know
CV
that.
matters, yeah.
I thought it did not. Okay,
CV matters a lot.
So, like, you would
CV
recommend people to
PLAB,
publish research, take up leadership roles and do those things for PLAB.
Yeah.
Okay.
And especially for PLAB, audit is important. Even though not doing an audit, but knowing about an audit is important. Because in interviews, they'll give you a scenario. They'll give you some scenario about audit and they'll be like, how to go about it. So you should know what is an audit, how to go about it, and what is like how you publish the results. And if you've done an audit, then well and good.
Okay. So, all right. Once you get selected, so like you said, like there are different kinds of jobs. Like are some jobs better than the other? And like, does the pay also differ like from job to job?
Yeah, see, that is different because some would be like, see, it's a non-training job. So again, it depends on where you want to work. Like if you're getting a job in Manchester, London, or any other place. So that depends on where you're getting a job. And secondly, you should apply to like all the job vacancies. You should not be like very picky that I want to work in London only, so let me just apply there. Because to be honest, it's the harsh truth, but you will be rejected and you should not feel bad about it. Maybe out of the 30 applications you give, you would not get a reply from like 20 of them, but you will get a reply from 10 of them. So you should not like lose hope and be like, this is not for me and I'm not getting a job and I don't know what I'm doing in UK. You should like just go with the flow and just like have some faith that you will get a job. You will get a reply from them. And if possible, if you have the expenses to stay there, it's much better to stay there for a while, because personal face-to-face interviews are much better than interviews over Skype. Because why would you want to take up a job where you've just seen the pictures of the workplace? Why don't you want to go and explore where you're going to work for maybe a few months or a year? So if you have the expenses, obviously you should prefer to just stay there and wait for a while and have the face-to-face interviews. That's going to be much better over Skype interviews.
So let's say, okay, you get a job. What happens then? Like, is it like how many years, like 1 or 2 years? And you said like it differed from specialty to specialty. Like for some like things like medicine, psych, you don't need that. For peds, like you do need like peds and surgery. Like what's that about?
So on the GMC website, you will find like specific points as to how they are judging your CV. So for like peds, they have like some number of points for this non-training job for 1 year that you do. Like it's sort of compulsory. So that gets you like more points on your CV. But that's not the same if you consider medicine or surgery. But personally, I have known people who want to pursue medicine and who want to pursue surgery, but they've not gotten through the interview in one go. Because there people prefer, students who worked for a while as a non-trainee and then have applied for interviews, because they know the system better. I mean, if you're lucky, obviously you're going to get it in one go. Yeah. But it's always preferred to work there over just applying for interviews.
As a non-trainee.
I won't say don't apply. Yeah.
As a non-trainee.
I won't say don't apply. I mean, if you're done with your GMC registration and all, I mean, I would, apply. But don't be disheartened that you're not selected. Because they do prefer people who have worked already over there.
Okay, and what is this internship thing about? Like, because some people say that like India, you have 1 year internship, and like they want 2 years internship, so you have to like do 1 year internship there too.
So that's the foundation here that I was talking about. So that
Yeah,
1 year is compulsory for me, like for like pediatrics.
but for
To
not for a few other specialties.
That's not there for medicine and surgery. Like if you check out the CV portion for surgery, it's not there. But it is like specifically, it's there in like peds and OBGYN. It's
Okay.
there. It's mentioned that you're gonna get like probably like I think 1 or 2 points. Like you should have 1 year non-training experience.
So let's say, okay, 1 year, right? You're gonna get paid for that totally, right?
Yeah. The only like the money you're paying is only till GMC registration. After that, if you're working, they will pay you because you're working for them.
All right. So let's say you work for 1 year and you can't crack the interview. Can you still keep working? And
Yeah.
you can make
Yeah.
money, right? Like I'm just asking
Yeah.
because yeah, okay.
Yeah. Yeah. I mean, that's what people do. They just like keep working till the time they get through the interview.
And once you get that interview, you are in for like your PG core training, right? 2 years, which you said.
Co-training.
And
True.
after that, you get your super specialty training
Super
from them.
specialty. Yeah.
The MRCP exam that we're talking about, you have to give it after the 2 years of your core training end, or do you have to give it within those 2 years?
See, you can give it within those 2 years. It's not like you cannot. You like as I said, you can even enter through MRCP.
Okay.
But it's like how how a person's confident enough to give that exam. So suppose for me, like if I join pediatrics over there and I get through and I'm in my core training and I'm getting used to their working, how they work and how they interact. And I would not want to, just give a very important exam of my life just when I enter that course. I would like to just know more about it because, like, see, PLAB is about, final year MBBS subjects and all. But MRCP is more your specialty, like more into pediatrics or medicine or surgery, which you wouldn't know at the starting because you've just joined. So you can give it if you're confident enough, if you've studied enough for it, but people prefer to give it by the end of your second year core training.
So let's say somebody's done PG from India, right?
Hmm.
If they get MRCP done, so they'll directly go into super specialty training, is it?
Yeah.
Okay, now that makes sense. Yeah. Do they have to do core training?
The problem is, no.
Or no?
No.
Yeah. Okay.
That's not there. But the problem with this option is that, if you do PG and then you apply, you give MRCP and then you apply, the issue with this is that subjects like pediatrics, OBGYN, ENT, Ophthal and everything, they have a specific amount of seats which open at the starting of your core year. So from ST1 to maybe ST8, suppose there are 20 seats. They are going to be those 20 seats only. So if I do pediatrics PG from India and I want to apply abroad, I will have to wait for someone to drop out from ST2 and then I will get that seat.
Oh.
Are you understanding?
Now
there's a specific seat.
Yeah.
Yeah. So for an IMG, it's very rare that an IMG will, drop. So they will have to wait. It could be 1 year wait, 2 year wait, 3 year wait. You don't know how many years because you are joining in the middle. So you need that one seat, someone to vacate it. But that's not the same for medicine and surgery. For medicine and surgery, new seats open up. So it's easier for them to just join specialty because there are new seats. But for other specialties, it's not the same. For me also, like I wanted to do first PG in India, but I had to change my mind because there is no point, first doing PG for 3 years, then preparing for MRCP, then giving MRCP, and then waiting for someone to drop out. Because that's very uncertain. That's very uncertain to just wait and be like, okay, someone will drop out, then I will get that person's seat. But that's not the same for medicine and surgery.
Yeah, and I've heard like so MRCP also has two parts: MRC Psych,
Hmm.
MRCP. All these
Yeah.
things have like two. Like the first
Hmm.
one is theory, and the second one is all
Yeah. And
practical.
then OSCE, yeah.
So is it hard to pass MRCP two without being there for a while? Like, because I've heard it's very hard, like to get through
Yeah.
MRCP two, especially if you haven't had training there.
See, again, MRCP is, a specialty exam. No, like it's specific to peds, medicine, surgery. So for an Indian PG, if you're not there, again, the way a PG works in India or any other country is very different than UK. So if you go there with the knowledge you have and the ways you work there, it's not going to be the same. So it's
All
going
right.
to be hard. And that's the same for like Tab 2 also. Like if you go there, it's going to be hard. You just have to like get used to the place and you get used to their system.
Once you're done with all these things, like, and let's say you start
Hmm.
working there as a consultant, like,
Hmm.
how much do you make as a consultant in the UK?
Consultants can go around this thing easily to like 5 to 6 lakhs per month,
All
like
right.
easily, and that is just 48 hours a week.
Yeah, that's insane. Like, because 48 hours are nothing.
Yeah,
You can also make more money through locums, right?
yeah.
That is also there.
Locums, yeah, locums are like basically extra work that you're doing to cover up someone. So you're gonna be paid more than what the person would be getting. So suppose someone is getting maybe 5,000 an hour, you would be getting maybe 7,000 an hour because you are covering up for that person.
Okay.
And if a locum is at night, then that's like
More.
60% extra than what that person would be getting.
The last thing I'm going to ask is like, so are there any problems that people need to be aware in the UK that, you need to be on the lookout for from the get-go?
So one of the thing is that, the 8-year fear that you aren't going to be a consultant till like 8 years. That's just a lot of commitment to the course and the field that you want to pursue. Secondly, the issue with UK is that you cannot get your parents. So if your parents are coming, they are going to come as dependents, like on a visitor visa only. So as per UK, your family is the interrogate family, like your spouse, your children. They are going to have benefits from your work. So suppose like, the health insurance and everything is going to be for your spouse and for your children. They do not consider the retrograde family as family.
Okay, because that might be a deal breaker for a lot of people,
Yeah,
because your parents get
that's
old
what.
and you have to take care of them. And what's the process for citizenship in the UK? Like, how long does it take to get
So you
citizenship
get
again?
permanent residency in 5 years and you get their passport in 6 years.
Permanent residency, you mean, let's say you start there as a non-trainee, like, is it from then?
No, like the moment you step into UK, like you've been in UK for 5 years.
You can
You
immediately
stay
get the
there.
PR.
Yeah, you'll get a PR. There are like some tests you have to give, about the knowledge, the Britain knowledge and everything about their culture. But yeah, if you're staying there for 5 years, you'll get the PR.